Hi, Dr. Tammy Penhollow with Precision Regenerative Medicine. Today I'd like to discuss bone marrow aspirate concentrate, or BMAC therapy. BMAC therapy is an FDA-approved use of your own body stem cells obtained from your hip bones or your iliac crests. It can be used in orthobiologic therapy, think large joints, hips, shoulders, knees. It's also used in the spine, can be used in the discs, in the small joints of the spine, in the epidural space, and in the sacroiliac joints to address things such as severe spinal stenosis, severe degenerative disc disease, radiculopathy, pain running down into the legs from that disc disease and from the spinal stenosis. Can also be used to treat that advanced arthritis in those large joints, such as the knees and the hips. More patients are turning to this therapy as they're trying to avoid things like spinal fusions, disc replacements, knee replacements, hip replacements. They're especially trying to avoid going into the hospital and having to deal with weeks of rehabilitation after a big surgery such as a spinal fusion or a joint replacement. Bone marrow aspirate concentrate therapy, or BMAC therapy, has the advantage of also including PRP, platelet-rich plasma therapy. It means it obtains the bone marrow aspirate concentrate plus PRP. So you have all of those anti-inflammatory proteins, all of those cytokines, and you also have some stem cells, your own body stem cells. The quality of those stem cells and the quantity of those stem cells is crucial. It's imperative that you choose a physician who is meticulous about obtaining high volume, high quality stem cells. When we draw stem cells from the bone marrow, from the iliac crest, we get two different kinds of stem cells. The first and the most numerous are called hematopoietic. They're the ones that can become different types of blood cells. We're most interested in the ones that become musculoskeletal precursors. They're called mesenchymal stem cells. I like to call them M stem cells for the musculoskeletal. And those can differentiate into or become bone, cartilage, disc, ligaments, and muscles. I'll show you how they're obtained, or where they're obtained actually. They're obtained from this area on the patient's hip called the iliac crest. You obtain that by having the patient lie down on their belly. Their back and hip bone areas are washed off sterilely and draped. This is a sterile procedure. A lot of local anesthetic is applied to the skin, to the tissues beneath, and even to the layer of the bone called the periosteum. Most people do absolutely fine with the bone marrow harvest as well as the placement of those BMAC cells into the target areas of the spine, the hip, the knee, the shoulders, or any of the other small joints under just local anesthetic. Occasionally, somebody requires a little bit of oral anxiolytic medication. Very rarely does a patient require any IV sedation. So this is a pretty simple procedure. It takes approximately an hour. It's done in an outpatient setting, and we are able to then apply these cells very targeted into the area that you need them in, using an ultrasound or a fluoroscope, a C-shaped X-ray, to deliver them to the target. Bone marrow aspirate concentrate is not all created equal. As I alluded to before, it's imperative that you have a physician who is an expert in obtaining these cells with meticulous and very sterile procedure. It's also important that the cells are processed appropriately. This involves centrifugation, placed into a centrifuge, and then those cells are concentrated. And I also send 1 cc or one very small amount of those cells to a laboratory so that we can get a total cell count on the stem cells. That 1 cc is a small volume, and we actually draw approximately 50 cc's. This bottle of vanilla is approximately 118 cc's, so far less than half of this bottle of vanilla is obtained through your iliac crest and processed in the centrifuge. So I'd like to talk to you about some really neat studies that are showing the efficacy of the stem cell therapy that we're using at Precision Regenerative Medicine. The first regards the spine. There's a physician called Dr. Patin who had 26 patients that all had discogenic or disc-related pain. All 26 of these patients were offered a spinal fusion. Instead, they had one disc level injected with their own bone marrow aspirate concentrate. Here are the results of that study. 2 of those patients had to undergo additional injection at that level. 88% of those patients had significant pain relief 1 year later. 40% of those patients had changes in their MRI that showed regeneration of the discs at 1 year. Only 1 of those patients had to undergo a fusion. Pretty cool. The next study I'd like to talk about involves the knees and use of BMAC in avoidance of or in comparison to a knee replacement surgery. Dr. Ernigo had 30 patients. They had bilateral or both sides severe osteoarthritis of their knees. All 30 patients had 1 knee replaced. All 30 patients had 1 knee that underwent BMAC therapy. These patients were studied for an average of 12 years, between 8 and 16 years. So during that time, they were followed, and here are the results. 6 of those patients who had knees replaced had to have revisions to the replacement knee. Only 1 of those knees that underwent bone marrow aspirate concentrate therapy had to go on to have a knee replacement. The improvement in function and the decrease in pain were similar between the replaced joints and the BMAC joints. There were far more complications in the joint replacement knees. Again, not all of these studies are quite as robust. The results are not. And it's because of the quality and the quantity of the mesenchymal stem cells. And that depends on who is obtaining the stem cells and how they're processed. So this can be looked at as the newest and latest and greatest of orthopedic stem cell use in avoiding spine surgery. Both the replacements of discs, the fusion of the back, and the other rotor-rooter type foraminotomies. It can also be seen as a great thing to try prior to considering these surgeries, prior to considering a knee replacement or a hip replacement. Why? Well, number 1, it can be a one-time treatment. It's minimally invasive, done in an outpatient setting. Extensive rehabilitation in a rehab facility is not required. Certainly physical therapy can be beneficial after this therapy to optimize the results. The complications are absolutely minimal, and we're getting some good long-term results. Up until this point, the therapies that we have been using, joint injections of steroid, epidural steroid injections, radiofrequency ablation to the back, knee replacements, hip replacements, spinal fusions, disc replacements are all destructive therapies. This is a constructive therapy. It's yielding regeneration of the tissues and of the cells. It's letting Mother Nature do what Mother Nature can do, and you're just optimizing it by concentrating those cells and precisely delivering to where they need to be. If you'd like to discuss bone marrow aspirate concentration therapy, BMAC therapy with me, please reach out, precisionmedprp.com. Again, this is Dr. Tammy Penhollow. Thank you.